Medical services provided by the PRCs were a direct, compassionate response to meet the needs of the clients presenting to the centers. In 2000, when the Pregnancy Resource Center of Metro Jackson began offering limited sonograms for abortion vulnerable clients, I became medical director. Then in 2006, I also became medical director of the Women's Resource Center in Jackson, which is a PRC dedicated to serving African American and minority clients. The Women's Resource Center began as a response to the fact that in 2004, according to the CDC, abortion is the leading cause of death in the African American community, accounting for more deaths than heart disease, cancer, violence, accidents, and HIV combined. The medical protocols and staff training were developed utilizing the guidelines from NIFLA and Heartbeat International. Review of cases and services are ongoing with the medical and nursing staff. A board-certified radiologist actually reads the sonograms. We also have a relationship with the university for referral of abnormal sonograms, as well as a system of referrals for prenatal care. From my experience, providing patients with medically referenced information is imperative in order for them to make a truly informed decision concerning their health care. Pregnancy Resource Centers provide medically referenced literature on a variety of pregnancy-related and sexuality-related topics, including risk avoidance, primary prevention of sexually transmitted diseases and infections, and the physical and psychological risk of surgical and medical RU-486 abortions. Materials distributed by the national networks are used at PRCs, is reviewed by national level experts in the field of medicine, psychiatry, and psychology. In the recent book, Hooked, New Science on How Casual Sex is Affecting Our Children, Dr. Joe McElhaney and I presented the medical, neurological, and social scientific evidence supporting risk avoidance and abstinence as a primary prevention of the emotional and psychological effects of casual sex. In serving recently with the Presidential Advisory Council on HIV/AIDS, promoting an effective prevention strategy was priority. Pregnancy Resource Centers offer a primary prevention or risk avoidance message. Centers vary widely in the number and sophistication of their programs. Community-based abstinence education programs are offered as outreach by some in schools and are effective in reducing sexual activity and thus reducing the consequences, both physically and emotionally. As we've already heard, some centers offer STD, STI testing and treatment, but all refer at-risk women for testing. The Pregnancy Resource Centers help women to achieve better health for themselves and for their children. By providing abortion alternatives, which include pregnancy support and information on parenting, primary prevention and adoption, they avert abortions, reduce the rate of repeat abortions, which according to the U.S. CDC in 2008 reporting 2005 data, repeat abortions account for at least 44% of all abortions. And the PRCs lower the incidence of preterm birth, which has associated risks. Previous induced abortion and subsequent preterm birth risk association has been identified and published in numerous studies internationally for over 2 decades. Pregnancy Resource Centers help to avert the mental health impacts of abortion for women, which include elevated rates of depression, substance abuse, and even suicide. For women and men suffering the emotional and psychological impact of abortion, centers are a safe haven, offering support, hope, and healing. Abortion recovery programs are available in more than 2/3 of centers to women, and more than 10% offer similar services to men. In Jackson, Mississippi, this service has been offered at the PRC since 1992. In summary, the purpose of the Pregnancy Resource Center's medical services are to promote women's health and maternal health and child well-being in a variety of ways, contributing to the reduction in the rate of abortions, averting mental health impacts, as well as providing valuable prevention messaging. And through their extended recovery outreach, Pregnancy Resource Centers open their doors wide to enable women to cope, heal, and make healthy lifestyle choices. Thank you.